symptoms. Symptoms of a disease is usually what the person tells you is wrong with her. You will not argue her. I don't know if you understand. And sometimes that symptom can only be seen by the patient. For example, if a patient comes and tell you, I'm having headache or I'm having pain in the hand, there is no way you will know whether she's having the pain or not. Once it is the word of the patient, I don't know if you understand, it is what? Symptoms. But signs are actually the one that the doctor or the health official now find out. So the sign might be different from the symptom the patient is saying. Now, there's also some signs that usually come with symptom. Now, patient will start ascribing that sign to symptom. Sign is different from symptom. When we talk about symptoms, we talk about what the patient is telling us, what the patient now tells us. Because the patient can come and tell you, I'm having headache or abdominal pain. I don't know if you understand. That one is what? Symptoms. Then when it comes to sign is now what you now find out yourself. Perhaps the person might tell you, I'm having headache. That one is what? Symptom. Then the sign is that we might go and check your blood pressure, we might check your pulse rate, we might check this and that and find out that this is wrong. That becomes what? Signs. So it's two different things. But there are some signs that people will mistakenly associate with a particular symptom. You will see a woman that have hypertension. Instead of taking her drugs constantly, suddenly she will tell you that she knows when her blood pressure is high. She didn't check the BPO, and you ask her, how do you know? She says she usually have headache. Now why she has risen, she now knows the blood pressure has risen. That is what? A lie. It's not true. There is no, anytime a BP start giving you headache, that means that blood pressure is already complicated. But normal blood pressure will give you no sign. So the only thing we can find in normal blood pressure is what? Symptom. And that symptom is that we have checked the blood pressure and we realize that it is high. Is it clear? Now, there is a whole lot of difference between, if you see a woman that comes to antenatal, there are some structural difference between the woman on antenatal and the normal person. Let's take an instance. A normal person that is moving up and down might just have leg swelling or body swelling. She is not pregnant. Once that happens, we already afraid, because it simply means that there is fluid retention. That means that she's taking more fluid than she's excreting. It doesn't mean that she take more than normal.